Well, good morning, good afternoon to everyone. My name is David Simmons, and I'm Policy Director at the National Indian Child Welfare Association. And I'm really glad to present on this topic. This is an area of practice that we've focused on for quite some time. Of course, all of us are familiar probably with child welfare services and foster care in particular. But our work tells us that there are an awful lot of families who could benefit directly from having more supportive services available to them to help keep children at home safely, and then even after children have been returned or reunified, to be able to make sure that they don't have to be removed again. So I'm going to start and tell you a little bit about the learning objectives here, and then we're going to move into the presentation. And as Tiara said earlier, we will have some time at the end for questions too, so just to let you know that. So the learning objectives are right here, and they're pretty simple. We want to help you understand some of the key provisions of the Family First Prevention Services Act, particularly those that apply to tribes. This is a fairly comprehensive, fairly large body of law, and so we aren't going to have time to go into every single provision in great detail, but we will try and hit some of the highlights. The second bullet here talks a little bit about trying to understand what are the differences between how the law might apply to tribes or tribal organizations that are running the program, whether the Title IV-E program, whether they're doing it through an agreement or directly, and even if they're not running the Title IV-E program. So the Title IV-E program is the vehicle for a lot of the requirements and pieces of the Family First Prevention Services Act. And Title IV-E just refers to a section of the Social Security Act, and this is in child welfare in the federal government, this is the largest funding source that supports child welfare services, and it funds in particular, up until this law passed, it was funding primarily services where a child was removed from a home and some of the administrative and then the training associated with that. And then the last learning objective we really want to understand some more. I'm going to share some strategies, some of my thoughts, thoughts of some of the colleagues I work with on how tribes can work with states to improve their access, particularly tribes who may not be running the Title IV-E program themselves. So I'm hopeful that we'll have some good discussion about that. So those are our learning objectives. I'm going to move on to the next slide. I think it's always important to have a little bit of context here, and we want to know a little bit about the numbers of children that could be impacted, Native children. So right now, Title IV-E is a program that's been in place since about 1981, and the states were the first to access the program. There were no direct access opportunities for tribes back in the 1980s and 90s. It wasn't until 2008 when another law passed. About every 10 years we tend to have somewhat landmark child welfare legislation become law, and the Fostering Connections Act passed that provided tribes with direct access like states to the Title IV-E program for the first time. So currently we have about, I believe the number has actually increased a little bit, it's around 12 tribes who have been approved by HHS to run the IV-E program directly, so it's a fairly small number of tribes at this point. However, when you look at how many tribes are operating the program under an agreement with the state, and IV-E provides that opportunity, since I think it was like 1983 was the first tribal state agreement on IV-E, we have over 100 tribes that are operating the program, the Title IV-E program, through an agreement with the state. And so when they're doing that, they're essentially part of the state plan, but there's a provision that allows the state to have agreements with what they call public agencies, which includes tribes. And then we have a much larger number of tribes who are not providing the agreement or not operating the Title IV-E program, and so many of those children would either be under state jurisdiction or possibly under tribal jurisdiction. And so we have some numbers of kids there as well. Probably the largest set of children who would be impacted by this are actually this latter group. So to give you a little bit more numbers here, we have between 9,000 and 10,000 Native children who are in state foster care systems every year. That number wavers, but not a huge amount over the last 10 to 20 years. This is information that comes through what they call the AFCARS system. It's Title IV's data system. It stands for Adoption Foster Care Automated Reporting System. And we know just through our own research and studies that there's probably about another 4,000 children who are actually under tribal child welfare jurisdiction and in their systems. One of the things that's interesting is that when you're looking at who's working with which children, tribal children, wherever they are always working with tribal governments. And so even when tribal children are in state custody, because of both federal law and also because of how tribes try to stay involved, you're always going to have tribes either kind of helping co-case manage cases for tribal children, even when they're in state systems. So tribes have a much bigger job than just the kids who are living in their communities. They're also looking at all those kids who are outside of their communities and are in state custody too. So another thing to realize is that the numbers of Native children in foster care across the United States is actually significantly higher than it probably should be. There's a real disproportionate placement of Native children, and it ranges from anywhere from just 1-to-1 kind of proportionate to as high as 16 times or more than their population rate in particular states. And so we know that there's definitely a lot of these kids and their associated families that could benefit from having more supports, hopefully to reduce their rates of foster care removal. And one of the things that we know about some of the data that looks at that disproportionate number of Native children in foster care, particularly state foster care, is that we know that when you look at the major decision points in child welfare, whether there's going to be an investigation after a report of alleged abuse or neglect, whether it's going to be substantiated, and whether a child will actually be removed from the home, we see that Native children are 2 to 4 times more likely to have the more intrusive decision and intervention happen for them. So this really this to us indicates some of why we have such disproportionate placement of Native children in state foster care systems, and where there are possibly situations where with more prevention services we could have better outcomes and fewer kids being removed from home. So some of the things that we know that keep tribal children in child welfare systems are things like unresolved trauma, historic trauma, current day trauma, and intergenerational trauma as it goes across different generations. And unresolved trauma often, and the word here that's really key besides trauma is unresolved, because in many cases child welfare systems are not able to provide the level of trauma-informed services that families and children need to help them be able to address the issues that brought them there in the first place. So in child welfare, as a former practitioner, when I think about a lot of the families I had on my caseload, almost without exception, all of those families had some kind of trauma that they were trying to deal with that then resulted in them having poor decision-making, mental health challenges, and substance abuse challenges. And when we don't deal with the trauma, of course, what we do is that we're just sort of putting a Band-Aid on those families and kids, and they're very likely to come back to us again later. Some other things that impact why tribal children are in child welfare systems too is structural disadvantages. So when we think about things like poverty and disparities in access to services, those are some of the structural disadvantages. And structural disadvantages are different than other kinds of impacting factors. So a structural disadvantage like poverty is something that a family itself can't control, can't solve on its own. It needs additional services and assistance to be able to address. And we see that many tribal children live in rural geographic areas where there oftentimes are not the same kind of services available to them. especially in tribal communities. So many times tribal communities, we hear stories all the time about families who have to drive 100+ miles just to get any kind of services in the area where they live. And certainly when services are not culturally appropriate, they're oftentimes ineffective and possibly even harmful depending on what the situation is. And so we know that that has an impact on the ability to help children heal and families heal as well. And then bias in service provision. Some of the data earlier indicates that there could be bias, both institutional or individual, and many times in these child welfare decisions. And then sort of insufficient post-reunification services. So many times, child welfare systems across the United States, tribal and state, often suffer from having not enough resources and services. And one of the places where we see there's a critical opportunity to help keep children at home is after we've been able to, after a removal, be able to bring them back into the family. Well, depending on where you're at, in some places or jurisdictions, there may be post-reunification services available that can go on for as long as 12 months or even longer. In other places, it could be very, very minimal kinds of services, which can then lend itself to children having to be removed again and the family having to suffer, and the children suffer from that trauma of removal. So on the next slide, so when I mentioned earlier there's other federal law that interacts with Native children when they're in child welfare system, I was referring to the Indian Child Welfare Act. So the Indian Child Welfare Act was passed after decades and decades of factors and actions, primarily by public agencies, but also by some private agencies, that removed children, Native children, in large, large numbers. Estimated between 25 to 35% of all Native children had been removed and placed in out-of-home care prior to the passage of the Indian Child Welfare Act in the 60s and 70s. So some of the things that the Indian Child Welfare Act tries to remedy is to try and make sure that those kind of conditions don't exist anymore, that we can reduce the need for unnecessary removals. And it does that by having certain requirements about when states are working with tribal families and children. And you can see I've highlighted a few things here that actually help facilitate tribal involvement and also better services to Native families and children. So three of these are directly related to the Family First Prevention Services Act. So the active efforts requirement, it's similar but not the same as a reasonable efforts requirement that many state courts and state agencies use to help prevent removal. And it just guides what kind of efforts are we going to make to help prevent removal in the first place and help reunify children after they've been removed. So the Family First Prevention Services, additional services in this case, can help implementation of the Indian Child Welfare Act. And so we really think about that when we're looking at the ICWA and the interface with this new law. Placement preferences is another place. Many times family members are going to step up and want to be that placement preference for Native children. It's part of the Indian Child Welfare Act as well. But in order to get families in a place where they can take children to, they need supports as well, certain kinds of supports in many cases. And the last one, the capacity building of tribal child welfare systems. Of course, if there's new funding and resources available, it can help bolster both state and also, of course, tribal child welfare systems. And so we always welcome that whenever it's available. So now I'm going to start talking more specifically about the Family First Prevention Services Act and tribal application. So the first thing I want to point out is that Congress, as they were looking at the legislation before it became law, and there were a lot of discussions. Our organization was involved in some of those discussions. Many others were as well, many tribes. One of the messages, some of the high-level messages that we gave members of Congress is that we said it's very important to get these kind of additional prevention type services in Indian communities and also with states so they can also have resources to work more effectively with tribal families. But we said that the same structure, the same kind of service delivery system that might work with non-native children very well may not work well with native children, especially in tribal communities. So we encourage Congress to think flexibly about how they made the funds available and how they applied the requirements to tribal organizations and tribes that might be operating these kind of family first prevention services. And so in the end, they apparently agreed with us, and they said that in the law, they said that they were going to make sure that tribes were eligible, but they also want to make sure that there was consideration and flexibility for HHS to specify the requirements that were applicable to tribes, maybe looking at them differently than they would necessarily for a state, and to do that in a way that would allow for cultural adaptation and cultural services that best fits the context of the tribal community and families. So this is not an unfamiliar type of provision that you see in federal and sometimes even in state law that helps guide the way that, and kind of pave the way for tribal services, more culturally appropriate services. So I'm going to tell you a little bit about the context, a little bit about the background of the Family First Prevention Services Act. I mentioned earlier that about every 10 years, Congress does some kind of landmark child welfare legislation. And in 2008, when they did the Fostering Connections Act, they were very focused on relative care and issues about how to support and improve relative support. So that was a big focus there. In the Family First Prevention Services Act, there are some things that address relative care issues, like kinship navigator programs. But they really, I think Congress asked the question, what can we do to try and tamp down the increasing numbers of children who are being removed from their homes and placed in out-of-home placements like institutional care, foster care, and other things? Seeing that this was not only was it increasing the expenditures on the federal and the state and the tribal side to kind of meet the needs of children and families, but when they began to look at the federal budget as a whole as it applies to child welfare, well over 50% of the money in federal child welfare expenditures comes from programs that require you to only be working primarily with children who have already been removed from their homes. So the kinds of services that could help prevent removal in the first place, keep children home safely, or services that could help children after they've been returned home, those kinds of focus were a much, much, much smaller, probably less than 25% of the actual federal dollars that are allocated each year. So Congress moved forward and they passed this law in 2018. In February, it was part of a larger Omnibus Budget Act, and the way Congress has been doing a number of things in the kind of human service realm has been often, rather than doing standalone, they've been doing things through these larger Omnibus Budget Acts. So what they did is they chose to open up the Title IV foster care and adoption assistance entitlement program. So they said, we're going to continue to allow the funds to be used for out-of-home placements, guardianships, adoption, foster care, things like that. But we're going to add a new component, and the new component is going to reimburse states and tribes, eligible states and tribes, for prevention services. So we're going to focus on how can we actually prevent removal in the first place. So they provided a very broad scope of how they define prevention services. So they included things like parent training, individual and family counseling, mental health and substance abuse treatment as they're under what will be eligible prevention services. And they also said that the services must be trauma-informed and evidence-based. But if you think about just the individual and family counseling and parent training, there's an awful lot there that really could help children and families who have experienced the trauma that puts them at risk of having children removed from their homes. And certainly mental health and substance abuse treatment, those are especially substance abuse treatment, is a factor in probably well over 3/4 of most of the child welfare families that are seen by tribes and states, and even higher in some cases. So clearly they were really trying to link the causes, the things that impact whether children and families get involved in child welfare systems, and opening it up to that. So one of the things they thought about, though, they said, is there have to be some trade-offs, though, too. So we're not going to provide basically an open-ended entitlement that will allow for complete funding of all of these services, and then no other changes to other laws. So within kind of the thinking, the theory that if we can improve prevention services and those prevention services being effective, then what we should see is we should see reduced need for children to be removed and placed in out-of-home care. So one of the things that they did within the Family First Prevention Services Act, they said, well, we're going to provide more prevention services access, but we're going to restrict out-of-home placements in kind of institutional or congregate care is where it's often referred to. So residential place treatment facilities, group home care, things like that. So it isn't that states and tribes can't continue to provide these kinds of placements if they need to, and there certainly is a place for those kinds of placements. But what they were saying is we're not going to, under Title IV-E, continue to allow the same level of a reimbursement for those, and you're going to have to find other sources of funding. So you can see some of the trade-offs here. So some of the other things that they also looked at was who would be the eligible recipients of prevention services. So they came up with 3 categories, essentially. So they said the first would be children who were essentially called foster care candidates. That's 4E language. But what it really means is just children who can remain at home safely where there's some imminent risk of being removed and placed in foster care. So this could be children who have never been placed in foster care but are at risk. We see in the child welfare system, if there's a report and somebody goes out to do an investigation, they might do an assessment and say, look, it looks like this family could use some services, and there is, if the situation, conditions in the home don't change, that risk for removal could increase. And of course, there are other situations where children are going to have been in foster care through other kinds of remedial services, rehabilitative services, been able to be returned. But the family may need additional services to ensure that there's stability there and that the child doesn't have to be removed again. So it includes a fair number of children when we look at it. It's not going to include eligibility for children who are currently in foster care or out-of-home care. So it's only children who have been removed and have been returned, or children who are at risk of being removed and haven't been removed. Another category is pregnant or parenting youth in foster care. They mentioned this is a category that we've seen some increasing numbers of youth who are pregnant or parenting while in foster care, and so they also made this group eligible. And then they also looked at the care providers. So they said a parent or a relative care provider who's providing those services to that or that support to that child is also eligible for receiving some of these prevention services in those situations. One of the things I would mention, too, is the duration of services. I mentioned there are some trade-offs. So it isn't an open, an undefined amount of time that you can provide the services. So the prevention services are reimbursable for a period of up to 12 months with the possibility of an additional 12-month period on a case-by-case basis. So potentially as long as 24 months prevention services. And it's not a lifetime kind of requirement. So in other words, if you have in one episode, in other words, where a child has been reported as alleged to be abused and neglected, and the services start to happen, you could use up to that 24 months at that point during that episode with a child. Now, if the child's returned home, things are looking good, and then the child might be removed again, that would be considered maybe a separate incident, and then in that situation, you could continue to use the prevention funds. When they talk about the services needing to be trauma-informed, for tribes it looks a little bit different, but it does say that the services need to be trauma-informed and as well as evidenced. And the evidence base, they develop these three levels: promising practices, supported, and well-supported. All of them require, in general, that you have to have some kind of manual or how-to that basically tells how to stay in fidelity with whatever the service is, and some level of evidence support that shows that both the program is beneficial to the kinds of children or families that it's intended for, and that it's not been revealed through study or whatever, that there is evidence that shows that it could be harmful or not beneficial. So that's interesting, because normally when we're thinking about evidence-based services, we're usually looking at primarily the evidence related to whether there's benefit or not, and not as much specifically about is there evidence about any harmful effects. So this was interesting that they've included that in how they're going to develop those definitions. They also have another category of services that can be, besides prevention, that can be reimbursed, and that's Kinship Navigator. So Kinship Navigator is something that's been around for a while, but it's really helping support kinship family members who are interested in either being potentially, on one end, being a support placement, a resource family for a child that needs to be removed from home, or even just to be a support to that child and to that family in other ways too. So both tribes and states are eligible for Kinship Navigator services, even outside of 4E, because there's yet another Navigator Services grant program too. And so we've seen a lot of tribes get real interested in this in particular as well. And as I mentioned also earlier, there's going to be some restrictions on the reimbursement of residential placements, congregate care, but it's always with this kind of caveat that we're really trying to support more family-based treatment and kinds of placements. So that's really trying to move away from institutional care for all but the kids who need it and for a reasonable duration, and move more and more towards family-based treatment. So you might say, well, what's the reimbursement rate look like? Well, this is one of the great parts of this law is that through FY 2026, the prevention services are going to be reimbursed at 50%. So that's a rate that is within Title 4E is considered to be a relatively good rate. It's not the highest rate, but it is a relatively good rate. But after 2026, starting in 2027, then the reimbursability will increase in most places to whatever the Federal Medical Assistance Program, or FMAP, rate is. And the FMAP rate for tribes in almost all communities where tribes have been approved to operate 4E is close to 83%, so that would only leave 17% non-federal match requirement. So there's potential to draw down a fair amount of federal funds in the prevention side of this to be able to support those kinds of services. So that's a real strong point, I think, here as well. So I want to move into talking a little bit about some of the tribal differences. So the states are required to provide, or have been required in the law, to provide a certain percentage of their services in that higher level of like well-supported category, 50% plus. And in looking at that, so they have to use those evidence-based services, and there's a very strong set of criteria with regard to what does it take to qualify in promising, in supported, or well-supported. And the Children's Bureau, under the Administration for Children and Families under HHS, has put together a clearinghouse, and they're taking applications in ongoing and have been now for about a year, looking at different services, programs that people are trying to get approved, because if you can get it approved by the clearinghouse and it's in the clearinghouse, then you can seek reimbursement of those types of prevention services. And they can come from a variety of places. They don't have to be strictly child welfare. They could be in mental health or substance abuse prevention treatment and other kinds of fields as well. But remember earlier I talked a little bit about how tribes are going to be given a little bit extra flexibility, and the Secretary of HHS did promulgate some guidance. And in the guidance, the Secretary said that tribes can claim for prevention services within any of the eligible categories that they deem are culturally appropriate and meet the unique needs and context of the community. So what they're saying is that tribes do not have to use those same evidence-based services requirements that states would have to use. So that's really big. That's a lot of flexibility, and it's really important to note that, I think. So for the 10 or so tribes that have already been approved to operate Title IV-E, they will get that flexibility. Other tribes who have not been approved to operate Title IV-E directly will not be able to receive that kind of flexibility, but it does leave open the door for some of those tribes. And I'll talk a little bit more about how I think we can kind of work with some of these requirements a little bit more. In a similar fashion, they left the definition of what is trauma-informed to how the tribe would look at that and how they would define what is a trauma-informed situation unique to their community. So the Secretary gave the tribes, both for prevention services and trauma and what is trauma-informed, that discretion to define that. And in the practice categories, the tribes are able to define the different practice criteria for the services, the things that make up whether or not this is an eligible service. And so they are not, and tribes are not required to have to spend certain amounts of money, 50% or more, on some of those well-supported practices. They can spread out the way that they the expenditures and the services that they're using in the way that they seem most fitting for their communities. So you can see already this guidance provides quite a bit of flexibility already for those tribes who are directly approved to operate Title IV-E. So time limited, this applies to both states and tribes. Of course, there's an additional 12-month period up to possibly 24 months. The states are required to have an evaluation strategy, a rigorous evaluation strategy to look at the different approved evidence-based services and how they're kind of playing out within their geographic areas. The tribes are required to have an evaluation strategy, but there's, again, more flexibility, so they may not have to use as rigorous and as expensive an evaluation strategy as states do, and it could look at more qualitative designs as an example. And reporting requirements, tribes are going to have to provide data just like states, but the Secretary is working, hasn't published this yet, so we don't know what that looks like yet, but we suspect that there'll be some different kinds of data requirements for tribes. And one of the things that states are required to do is to meet a maintenance of effort requirement. In other words, they have to, even after drawing down these prevention funds under Family First, they have to continue to use the same amount of state dollars they were using before to support prevention type services. So they can't just reduce it because they're getting these new funds. Tribes are not required to meet any maintenance of effort requirements. But what I would say is that, and I've seen this in the TANF program, Temporary Assistance to Needy Families program, where tribes and states are both funded, a number of states that have tribes within them who are operating the TANF program and where they're collaborating a little bit together, the states, if the states are providing some level of assistance, they can claim that as part of their maintenance of effort. So there's certainly some opportunity here for states and tribes to collaborate, and the assistance that the state could provide could potentially be counted as the state's maintenance of effort requirement. So I've listed some questions here that talk a little bit about, or ask questions about, some of the issues that I think are real key here as we kind of move forward. We know that the largest number of children, Native children, who could be impacted by this law positively are not the children who are part of those 10 or so programs, tribal programs, where Title IV-E has been directly impacted. We also know that there is great need within tribal communities, both urban, I would suggest, as well as rural reservation communities, for these kinds of prevention services. And we also know that there are lots of precedents for where tribes and states have come together and collaborated, formed data sharing agreements, done co-case management, shared resources, funds passed through other funds to tribes in many cases. So we know that these kinds of things have been around for several decades. So I'm going to just start with a couple of questions here, and then I'm going to kind of work through a little bit, and then after that I want to open it up, I think, to have some questions and answers with the people who are on the call today. So the first question is, what are the opportunities to revisit the interpretation that tribes and agreements must meet state requirements? So because there is such a larger set of tribes operating the program through an agreement with states, we are hopeful that maybe there can be some work to change that requirement so that those tribes, who are essentially doing almost all of the 4E components already, could also have the same kind of flexibility that tribes who are doing it directly would have. So it just makes sense to us. I think that that's something that needs to be discussed more, probably with the Children's Bureau around implementation issues here. But I think it's something that's really could really, could increase tenfold the number of children who could benefit. So that's something to think about. And what are the opportunities for states and tribes to use culturally adapted models? So the way we think about cultural services is we think about culturally based. Culturally based services are those services that are based first and foremost, their framework, their structure is completely rooted in the cultural practices, traditions, beliefs of that particular tribe. But many tribes, especially in an age where we're seeing increased requirements around evidence base, are looking for ways to take more mainstream evidence-based services and then culturally adapt them to be used within their community and with certain Native populations. So the Children's Bureau, in earlier guidance, makes it clear that they are aware that there's an interest in doing culturally adapted models of mainstream services. One of the things that we know is that just in child welfare in particular, there are not a lot of evidence-based services that have been documented and have been approved, both for this law and just in general. And many of the services that are evidence-based are often coming from mental health and substance abuse treatment areas and prevention areas. So and many tribes have had experience culturally adapting different kinds of more mainstream evidence-based programs and services. So this is something we think that would be good to talk with the Children's Bureau some more about and see what some of their thoughts are, express some of the thinking that we and experience that exists within Indian country. I think about this even broader than just for Native children and families. I think about all the different populations, children and family population groups who could benefit from having culturally adapted models be eligible as well to receive reimbursement under this law. So I think that's an area that's ripe. And I'll note that in the state of Washington, as one example, not the only, the state there has been working with their tribes to identify, asking them basically, tell us about some of the services and programs that would fit into this prevention category that you believe have been useful, culturally based, and maybe culturally adapted too. And so the state is really working with the tribes kind of hand in hand to try and develop and help pull out some of the evidence and make some of these tribal services be able to get approval as well under the Family First Prevention Services Act and be in that approval clearinghouse. So I think that there's some opportunity again here, and I know like California and Oregon have also done some work in the past with their tribes. on this as well. So thinking about what are the opportunities there to get more kind of, even if they're not right at this point, if they haven't been formally studied, there's still evidence, there's data probably that can be gleaned to help build that evidence base. Next question is, what are the opportunities to improve the list of eligible prevention services for Native children and caregivers? I think this is similar. I think we can improve that. I mean, there are so many services. An example of this is we were working in Alaska a few years ago, and one of the things that we realized is that many of the state caseworkers weren't really familiar, weren't aware of how many of the different kinds of services and supports that many of the Alaska Native villages had within their communities. And so as we helped work with them, we helped them develop a matrix and sort of an assessment process for this. Almost all the Native villages that we work with were able to double, triple, quadruple the number of listed services, things that wouldn't necessarily be on a website or somewhere, but nonetheless were really critical services that were being offered to children and families from their community. Many people in the state said, I had no idea. We didn't know that we had this many supports, this many services in Indian country up here in Alaska. And so I think it actually helped increase the number of referrals for those services too, which is always a good thing. So I think that using those kinds of processes, I think there's an opportunity to improve and to increase that number of eligible prevention services. And one of the things I would say also about that is to differentiate and to educate. So to differentiate the difference between different tribes, so having certain services that are more culturally based is good, but we know that we have over 574 federally recognized tribes, each with different communities, different kind of culture. And so we want to make sure that we're educating people about the differences between, not just assuming that you can get one parent training model or one family support model that will work for every tribe everywhere. So we need to be thinking about how we can improve awareness about those kinds of issues. And last question here is, how will the kinship navigator requirements impact support for tribal programs and Native caregivers? We think that there's a lot more that could happen here. To date, I think there's been about 10 to 15 tribes who have gotten grants to do the Kinship Navigator program in the past, and we know there are probably a lot more that would like to. So the question is, how can we get more of those resources to tribes as well? This top question on slide 14 talks about national foster care standards. This is something I've spent very little time on it, but there was a provision in the law that talks about and required the Children's Bureau to develop a national list of sort of foster care standards. And the process has already happened. It happened last year primarily, and out of that came a national set of foster care standards. It's not required that tribes or states have to follow those exactly, but what it is that they have to, if they're going to get 4E funding, they have to submit some description of what they are using and how it differs and why they're using something that's different. So that's something that happened I wanted to highlight just quickly. And then the other question here says, can the HHS tribal guidance be interpreted to apply when a tribe contracts with a state to provide prevention services to Native children in care? This is really talking about that application for tribes and tribal communities where the tribe is not operating the Title 4E program directly or in an agreement. So we know that there's been lots of examples of tribes and tribal organizations contracting with states to provide different services using different funding sources. So the question is, can we find a way to use the guidance to have it applied for what would, arguably be the largest set of children and largest set of tribes, so that we can encourage tribes to say, you don't have to run the Title 4E program in all of its pieces to be able to provide maybe a culturally based services that are effective with children and families, and the state can work with you on that and have that be reimbursable under the Family First Prevention Services Act. So I think it's trying to think outside the box here again to be able to show and talk with the Children's Bureau about other opportunities. And I would also say in this regards, I don't think it's just, while the Children's Bureau has oversight over this law, that's clear, certainly SAMHSA as well could have a key role here, and I understand that SAMHSA and the Children's Bureau have been working together a little bit on the implementation of this, because SAMHSA also has a large body of evidence-based services and things too, and the question is, how many of those are tribal specific and tribally tested, and are there opportunities to increase some of those services so they can become eligible for the Family First Prevention Services Act? And I mentioned in these last two questions, so the question about active efforts. So I think that sometimes we face situations when at NCWA we're trying to help tribes work with the Indian Child Welfare Act's implementation in particular states or jurisdictions. And sometimes the response we get is, well, we don't have those kinds of services available. So I think making that direct connection between successful implementation of the Indian Child Welfare Act through active efforts especially, and also with the implementation of the Family First is something that's very positive. Again, this is for kids oftentimes whose tribes don't operate the Title IV-E program in many cases. So it's another way to reach that larger population. And the last question here is, how will Native children in state or private group homes be impacted by QRTP requirements? So that's qualified residential treatment programs. So we know that there isn't going to be the same ability to seek reimbursement under Title IV-E for those kinds of group home congregate care placements. How does that affect? We know that there are a lot of Native children who need specialized treatment, who experience very significant trauma in their lives, and some of their family members. And so the question is, what would that look like? What's that going to look like as when we're talking about Native children? One positive example I have is that under some of these new requirements under the Family First Prevention Services Act, they do add a category of prevention service that's eligible for reimbursement that I know has worked in Indian country in some places, and it's residential kind of group care where parents go with their children. The parents are going there to get usually some kind of mental health or substance abuse treatment, and they can bring their kids with them, which really makes it much easier for them to be able to focus on their treatment. And here in Portland, Oregon, we have a program that's been doing that for many, many years, the Native American Rehabilitation Association, and they have that kind of group care facility. So there aren't a lot of group care facilities in Indian country in general, but there are certainly a lot of tribes who would like to be able to do more. There are some real questions, some serious questions about what it takes to get certified to be one of these kind of QRTPs and be able to meet some of those requirements. But I think it's an interesting question, and we should, in mental health too, be asking this: how can we help support tribes and tribal organizations to be able to develop their own programs in this area as well? So that's the presentation. I see we have about 10 minutes left, so I'm going to stop here and I'm going to see if there are any questions that I might answer. Tiara, I see that we have some questions in the public chat. Are there, should I look at those questions or should I look at the questions over in the presenter chat?
It is totally up to you. They are the same questions I pulled over there, so feel free to answer in the order you would like.
Okay. All right. Well, I'll look at this first question. It looks like it says from Paul Davis: does a tribal child need to have official designation to be in this category, and how is it determined that someone is a tribal child? Well, under the Indian Child Welfare Act, a tribal child is somebody that a tribal government, sovereign nation, tribal nation government determines. It's like they're determining their membership, their citizenship. So a tribal child as a political status is determined by the child's tribe, and so they would be the one who would be making that decision about that child's eligibility for tribal citizenship. That's not to say that there aren't people who self-identify as having American Indian or Alaska Native ancestry. who may not actually qualify for any particular tribe citizenship criteria. But when we think about it, at least in the child welfare side of it, we're thinking about children from federally recognized tribes who are recognized as members of those tribes. There's another question. It says, can we have a list of the evidence-based practices that are expected to be used? Well, yes and no. So it's a growing list, so it's kind of a rolling list that this clearinghouse, which has just recently been set up within the last year, they're collecting applications, and so there's an application process where you have to submit the evidence for the particular service or practice. And so right now, I think the list includes, right now it's not moving real fast. I think there's only about 10 or so, about 10 to 15 practices on that list, and but it's going to grow. So I can send, Tiara, I can send you a link, and maybe we can send it out to people that would have the kind of clearinghouse information, and that will help people understand a little bit more about what that's about. And then the other question here, looks like from Anthony Catlin, is Caitlin, what year was this law created? It was passed in 2018 in February, but the actual ability to seek reimbursement didn't start until October 1st of 2019. So we have now, I believe, about we don't have any tribes who have been approved to draw down the prevention services funding yet, but we have, I think, only a few states that have. Several states have been approved, I think about 4 or 5, I shouldn't say several, a few, and more are planning on submitting here in 2020, I understand. So the process is not flying very quickly right now, but it is going to be happening, I think, ongoing. This is one of those laws I think is probably going to take us a few years to really understand, because the implementation of it is going to kind of move relatively slowly. Did I miss anything, Tiara? I don't know if I missed any questions.
No, those are all the questions that were posted during the presentation. We'll give it a little bit more time for folks to continue to post any more questions, and in the meantime, I'll also post some of the resources that you shared with us as well.
That's great. I'm going to, while we're waiting, I'm going to look up the clearinghouse.
So while we're waiting for additional questions, please also stay tuned to stay connected so that you can complete a brief survey at the end of the webinar. If you do have to leave early, we did post a link to the survey in the chat box, and I'll repost it again for folks to find it. But we'll give it just a couple of more minutes for folks to get their questions in, and then we can wrap up if we don't have any more questions. So just another minute or so for folks to type.
Tiara, I just sent you the link to the clearinghouse, and actually I sent it twice. So just look at the first link, and that's the link that will give people the information I think they're looking for.
Awesome. And so we will make sure to post all of the resources that you shared today, David, in the description of the recording of the video. So I will also post a link to where the recording will be housed. So we'll make sure that all of those resources are stored with that video in the description as well. Thank you.
Okay.
Okay, so if we don't have any additional questions, I think we are all right to close. Thank you so much for this informative presentation. And if folks, of course, have additional questions, David's email is right there on the screen. You can also get it from the PDF copy of the presentation below, and just click on that and click download files. And again, we'll also be posting resources along with the recording on the TA Network's YouTube page. And everyone registered will receive information on that once the presentation has been edited and posted. David, do you have any closing remarks for us?
No, just thank you to everyone for being on the call with us and enjoying the webinar. And if you do have other questions about the law, I'm happy to try and answer those. So go ahead and email me.